The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, hot topic, mommy makeovers. With us, we have an expert on the topic, Dr. Winslow. Dr. Winslow, welcome to the program.
Thank you.
Now, before we get into today's topic, tell me a little bit about your practice. I guess it's in Sacramento, Cameron Park, on natural plastic surgery.
My practice is universal. That is, it extends from cleft lip, palate, burns, congenital anomalies, cosmetic, hands.
Okay, on to today's topic, mommy makeovers. What defines it?
Those are mothers who have finished having their children and perhaps nursed them. They gained a little too much weight and haven't lost it all and can't get rid of it by exercise and diet, and they're sort of discouraged. And they come in with stretch marks and sagging of their breasts, and they're too small, and they can't wear clothes. They're self-conscious, and they're ready for a new life.
Let's begin with breast lifting, and let's talk a little bit about technique. At what point does somebody need a lift, by the way?
Well, there's certain standard measurements that are normal. For example, the distance from here to the nipple should be 18 centimeters, maybe 20 in a slightly older patient, but not 24 or 30. So it depends on the measurement. And then it has to be lifted by the amount that will bring the nipple to this point, bring that distance down to 20, let us say.
Okay. Now, do you go over the muscle, under the muscle? Let's start there, and then I have questions about incisions, where you place the incisions, things like that.
Well, when you're talking about over or under, you're talking about the pectoralis muscle, which is this one.
Okay.
And I always go under, unless there are extraordinary circumstances, one of which could be patient request, but I recommend going under the muscle because a thicker covering gives you a softer result.
So incisions, where do you place your incisions?
Well, in many ways you can place them. You can place them in the armpit, you can place them in the nipple or around the nipple, on the bottom of the breast.
Like in the fold?
Yes.
Okay.
Or even through the belly button, but I don't like any of them. And so I make mine on the bottom of the breast, not in the fold, above the fold.
Interesting. Okay, so not in the crease at the bottom of the breast. I mean, would that be the best place to hide it?
Well, yes, except the underwire of the bra tends to rub there, and then you have a problem with can have a problem with the scar. Okay. So I like it up a little bit from there, maybe an inch or half an inch above that line. Now, I was originally taught to do it that way, and then I tried the transaxillary, the transareolar, the periareolar, even the belly button, and they're all too difficult, too complicated. They slow the procedure down, and I think it's important that the simplest thing is the best thing.
Does it give the best result, though, as far as natural-looking breasts?
Absolutely, because the problem in breast enlargement is right here, where the serratus muscle, which is coming between the ribs, and the pectoralis meet, and they interdigitate.
Okay.
And there's fascia. Fascia is the tight tissue that binds all muscles. And if you cut the fascia, the muscle will bulge through. So you don't want to do that. But down here, you have to have fascia to support the weight of the breast. That is what makes the whole operation submuscular. Okay. Because the pectoralis doesn't come down to the lower third of the implant. So you've got to have something to cover the lower third, and that's the serratus fascia. Okay. Now, the nipple.
I've had doctors come on the show and say that it gives you more control of the pocket. It's easier placement of the implant. What are your thoughts?
I think those are all true statements, but that misstates the case. First of all, the scar around the nipple can be unattractive. Okay. Second, it may interfere with sensation to the nipple more than any other incision, which is important. Okay. And there's an even a better variation. Instead of going around the nipple, you can go through the nipple. Interesting. You have the same exposure, the scar is invisible, and there's no interference with sensation since the nerves come around this way and your incision would be going between the nerves, not across them. But Nobody likes a scar in the nipple. The nipple's a beautiful thing.
But it's being done all the time.
Should be left alone.
Yeah, no, I agree. and I think most people would agree that if that's the most beautiful part of the breast, why go through there?
Right.
So you rarely then go through the nipple area?
Almost never. And I never go through the axilla anymore either. When I did that, I found there was a tendency to cheat, which by that...
What does that mean? Yeah.
That means making the incision a little longer or lowering it from the dome of the axilla where it's supposed to be down onto the chest wall in order to get an implant in, especially a gel, which is very difficult to do through the axilla.
Okay.
So I don't do that. And I think the inframammary is the best of all of them. It heals beautifully.
Underneath?
Yes, right.
Okay. So what's your take then? You know, and you're doing it because the best results, looking results.
I think so.
So and I'm trying to get this. So is your opinion though that doctors who go through the nipple area, it's just an easier shortcut, easier procedure for them to do?
No, I think it's a good way to do it. I've done it that way, and I will do that if the patient wants, but I don't always like the scar.
All right.
And I definitely don't like a patient who complains about lack of sensation as a result of the surgery.
So do most of these women, I mean, do they tell you that they've been thinking about it for years and years and years? They haven't liked their breasts for years and years and years, and they've just been afraid to do something about it?
Well, yes, but even to the point of not wearing bathing suits or being seen out in public, it's with them all the time.
So what is the biggest fear then? Because there's a lot of women obviously that want to lift, but they're afraid.
Well, probably the scars. But I have an example in the office of someone who's had this done, and at that point I show them that patient where you can hardly see the scars at all, and that's very reassuring. Let me tell you the story. My wife and I went to a little shop in the mall, and she tried on a dress which fit beautifully. But while we were there were a bunch of girls looking for debutante gowns, and they were all complaining about the fact that the gowns didn't fit on their top.
Okay.
And they couldn't find anything that worked, and I kept wanting to say, can't I go up and tell them something can be done about that? They can feel good about themselves instead of so negative?
Now, what are the frequently asked questions on the consult of this mommy makeover? And by the way, if you're just tuning in, we're talking about mommy makeovers today, tummy tucks and breast lifting, so and also augmentation. But what are the frequently asked questions?
Well, there are two.
Okay.
One is the scar, and second is the nipple. And everything else falls into easy answers beyond that.
So with determining size on a lifting procedure, and not all of these people are, I guess, are getting implants on the lift.
That's correct. There are 3 or 4 kinds of breast problems other than being too small. One is a sagging breast that is too small. That requires an implant. The second is a normal-sized breast that requires a lift only. The third is a breast that's too big and sags.
Okay.
And the fourth is one that's too big and doesn't sag. So each of those has to be handled differently.
So with the one, after pregnancy, they've lost volume, maybe very little breast tissue at all, and they need an augmentation. How do you determine size? What's that process?
That's an interesting process because we have a lot of implants in the office that are samples. Okay. And we have bras, and we put them on the patient and put in implants, and then they put clothes on and look in the mirror. And we want to get a balance between the breasts and the buttocks. They have to offset or balance each other in order to look good.
Interesting. Tell me about that. What do you mean?
The sizing is done with a mirror and the patient looking at her profile. And we go up in size beyond what I think might be all right. We push it until the patient is revolted.
Okay, where they're too big. Okay.
Right. So, whoa, that's way too big. And then we back off until the patient says, that's pretty good. Now, the patients are usually shocked because they're so surprised. And they, cover their faces.
What are they surprised about? Just how good they look?
The weight.
Oh, okay.
And the whole thing, they say, this is what I always wanted. I can't believe it. And sometimes they get too frightened and they back off and they don't go quite large enough. But basically, it's much more successful than what we used to do, which was nothing, except guess. And that's when people would come back and say, well, I wish I'd gone larger. And many people did that. I haven't seen a patient do that in a year or many years.
Of the two, that they should have gone larger or should have gone smaller, which one is the biggest complaint?
They didn't go big enough.
Is that right?
Yeah.
Do you tell them that?
Well, they tell me that when they come in post-op. I wish I'd gone larger.
Right, but do you tell them, I mean, on the initial consult that you know, you got to make sure you go big enough so you have no regrets?
Yes, but we have two opinions here. We have theirs and mine.
All right.
Now, if the two are the same, then we're pretty happy. If they're different, then we have to resolve that conflict.
How have implants improved, by the way, over the years? And we're specifically talking about gel-filled or silicone.
Well, don't forget saline inflatable.
Okay, okay.
The saline inflatable has been the standard for almost 20 years since they took gels off the market. And with no other options, it was fine. Nobody complained. But it did have some problems. First of all, it tends to slosh. And second, they ripple.
These are the saline filled?
The saline filled.
Okay.
Now the ripples, if they keep occurring, it becomes a weak spot, and that's, I believe, leads to ruptures. The new gels, which have been approved over the last 2 or 3 years, are phenomenal.
Okay.
They don't slosh, they don't ripple as much, and they are soft and natural. They're basically unbelievable.
It feels like flesh. I've had
absolutely correct.
The implant manufacturer.
Every time I see a patient in post-op, I'm thrilled myself by how wonderful they feel. And they just get better and better and better for a year and a half.
What do you mean by that, they get better and better and better?
Well, at first they tend to ride high because the implants are round. They're not teardrop shaped, but they will become teardrop shaped due to gravity. So they'll get flat on top and full on the bottom, which is what we want. But that takes time. It's not that way originally.
So the implants themselves, I guess there's you know, some of the new advances, high profile implant. Seems like that's what everybody would want.
There are all sorts of variations on implants. The high profile is one that would be suitable for someone with a special physique, such as a narrower chest, where we need to have a narrower base to the implants so we can maintain cleavage. But there are other things that have been done to implants. For instance, some are shaped. They're not round. And those have to have some adhesive attached to them, which will grow into the tissues of the patient to prevent them from rotating, because if you didn't have that, they'd be upside down. That would look terrible.
Okay, okay.
Then there's another covering of the implant, which is sort of like Velcro, which the tissues attach to. That keeps the implant in place, but if that implant gets a ripple, that's going to be reflected in a ripple in the skin, which is unacceptable. So I use round, smooth gels.
Okay, we're going to take a quick break. We come back, tummy tucks. And what can expect, what the downtime is, and who's an ideal candidate. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, mommy makeovers, and we're discussing tummy tucks after the break. We'll be right back.
Well, I was in my 20s. I had both of my children by that time, and then I put on 70 pounds and lost it quickly because I had to be in a wedding. Well, the result of that later was my stomach looked awful. And I also, after that, went into teaching aerobics, exercising, lifting weights, you name it, running, and I still had this flabby belly. I just felt really, really embarrassed. So trying to find clothes to wear to cover my stomach, to make my breasts look perky, to give a little lift here again was very, very difficult, especially as the years went by. So after meeting Dr. Winslow and having the surgery, what a life-changing experience it was. You should have seen the way I could go and try on dresses, cocktail dresses with no, you know, they could have straps, no bra underneath there. I could put on a bathing suit. My tummy tuck scar was hidden underneath the bathing suit bottom. Nobody would ever know. And then later he decided he was going to take that scar around, and it's called a body lift, because I had sagging skin on my rear end and my upper thighs from babies, from overweight. And it didn't matter how much exercise I did. I mean, I think I was working out 2 hours a day. And still, I had this skin problem. So he said, let's try a body lift on you. Well, unbelievable. My rear end is high. It is smooth. People say I look 10 years younger than my age all the time. As a matter of fact, they're pretty shocked when I tell them how old I'm getting to be at this point. So I'm just thrilled. I just don't know how in the world I could feel this good if it weren't for plastic surgery and Dr. Winslow's skills. And I've also noticed, based on all the people I talk to, how much Dr. Winslow's work looks so natural. No one would ever figure it out, even if I just had a bathing suit on. I mean, I can have that little, that much skin showing, and it's still very obvious that I have a very nice figure. I'm fit, and well, I have a wonderful body at this point, and it has just changed everything for me. So I walk much more confidently. I walk taller. I also feel good about my age, and it's, you know, it's fun to look beautiful when you've gotten older.
Tried all sorts of cover-ups for bad breath? Try the science of Breathorex. Only Breathorex has Zytex. It attacks the cause of bad breath, keeps working for hours. It's clinically proven for real fresh breath.
Get non-prescription Breathorex from your dental hygienist and now at fine stores everywhere.
Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
I'm Dr. Winslow's office manager, but I was his patient first. Back in my 20s, I'd had both of my boys, and then I had put on 70 pounds. I guess it was depression. Anyhow, I lost that 70 pounds in a hurry, and I had all this loose skin left over. Babies, losing weight. So I was very embarrassed. I remember always trying to hide my belly, always trying to hide the sagging breasts that were starting to happen to me. I would buy clothes where I couldn't actually show my waistline. I'd have something kind of loose on the top. So Dr. Winslow did a tummy tuck on me, and he also did a breast lift. What a life-changing experience. I would go and try on dresses, cocktail dresses. I didn't even have to put a bra on underneath those and try to lift everything up because the breasts were lifted, my tummy was flat, I could wear those slinky, sparkly things. And I remember all the young girls around me, 20 years my juniors, that couldn't even fill out their dresses. They couldn't, they just didn't look nearly as good. And here I am going on, I think it was 45. Well, after I had the tummy tuck and body lift and my breasts done, it was just such a life-changing experience because before that I felt invisible. I had lost that, you know, I was pretty attractive, it seemed to me, because of the attention I used to get, and now I was getting it again. And that just made me feel wonderful because after all, we think that after we're, I don't know, 20 or 30 years old, it's over, but it doesn't have to be. I know that fear holds all of us back. It held me back because I didn't know what to expect. If you come in and meet Dr. Winslow, I think you will find, first of all, he is such a wonderful artist. He takes the fear out of all of it. And I believe he'll give your life back. He gave mine back. I would recommend it to everyone and anyone. I think it's just life-changing.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, mommy makeovers. With us, we have an expert on the subject, board-certified plastic surgeon, Dr. Winslow. Okay, so we've talked about breast lifts, now the tummy tuck. So at what point does a woman need a tummy tuck?
Most patients who come in about their abdomen are hoping that fat suction will be the answer, but for most of them that isn't the case. And the tummy tuck is what they really need.
Okay.
Now this is for patients who have what we call crumple tummy.
All right.
So it's all of that loose skin and fat that you can bunch up in your hand practically, whereas fat suction might be for other areas of the body.
Okay.
The pathology of abdominoplasty is that in addition to muscle looseness and skin excess, the spine is deformed by the weight of the abdominal contents pulling on the back. So these people have more than just a problem of crumple tummy. They have symptoms in their spine.
Okay.
And when you do this operation, which is probably the best or most gratifying operation I know,
really,
it's because not only do they look better regarding their abdomen, but their spine is straighter and their abdomen is stronger, so they stand up better, and clothes fit them, bathing suits fit them, Everything is different.
Now, the stretch marks. Help me understand that. I'm not quite sure. Okay, so if a woman has, 4 or 5 inches worth of stretch marks, you get rid of those. How?
In a tummy tuck, we excise all the skin and fat from just above the belly button down to the pubic mons.
Okay.
That's a big gap. And
so that could be like this big?
Well, maybe not that big, but it's pretty big.
Okay,
yeah.
All right.
And you can't simply close it. So in order to close it, you have to dissect along the abdominal wall up to the ribs, which is another reason why I wonder about doing it with augmentation, by the way, because it's too close to that incision.
All right.
But anyway, and once all that tissue is loose, then it begins to be stretchable and come down, but it still doesn't make it. So we have to put the table into the sitting position. As the table is cranked up into the sitting position, you can see the gap narrowing and narrowing and narrowing, and finally it reaches, and then you sew it up.
So in other words, you're taking out a part of their abdomen, the stretch mark area, or the crumbly area, and then you're pulling them together.
Yes.
Is that right?
Yes.
Okay,
but
good.
You're pulling the upper down, not the lower part up.
So you're pulling the upper down.
Right.
Interesting.
And before we do that, we sew the 2 muscles on the abdomen together.
So, like the six-pack area, it becomes expanded when the stomach gives out, or the abdomen gives out.
Yes.
So
well,
you tighten that together as well.
That's part of the pregnancy process. Stretches the muscle, and then it doesn't all go back to normal, especially if it's done over and over again.
So the muscles are actually tightened as well.
Correct.
Interesting.
Now, it's not the muscle that it gets tightened. It is the space between the muscle. That's fascia again.
Got it, okay.
That gets eliminated as the muscles are sewn together. And then we flex the table.
Then they have a flat stomach.
Yes. And then we pull the skin down, and we thin that flap a little bit, very cautiously, and then sew it up over a couple of drains.
So that incision, though, can be hidden under most bathing suits, obviously,
yes.
Depending on the bathing suit.
But, it's more than just bathing suits. Their clothes fit better in all regards, and it's like the breast. It changes their life.
But a flat stomach, though, I mean, everybody would agree. It's a good look.
It certainly is.
It's a healthy, fit.
Right. They can go to the pool. They can wear skimpy clothing.
So do these women come back and they, because you flatten out their abdomen area, they are dressing differently, acting differently?
Certainly. They wear tighter clothes and showing themselves off. They're proud of themselves.
So you brought some photos of some of your tummy tucks.
Yes, 2.
Okay.
Here's one. She has a scar from previous surgery.
That was a last surgery.
And
okay.
a fat roll above that scar.
Okay.
That roll could be handled by fat suction, but then she'd have loose skin afterwards. So I think an alternative would be abdominoplasty.
Okay.
And when that's done, you see the difference. She's flat and tight.
Yeah.
And her posture's improved, and her clothes fit better. You can see that she could get into jeans, which she couldn't before. And
perfectly flat stomach.
Yeah.
So is this when you get a mommy makeover patient, okay, they don't like their breasts, they don't like their abdomen. What do they hate the most? I mean, is it their abdomen that bothers them or their breasts that bother them?
That changes from day to day.
Okay.
No, right? they're equally annoying, and it sort of depends on the patient's activities and all of that.
Okay. Now that right there, what is that?
Here's
wow.
a second patient.
What am I looking at there? This is just...
This is a patient with stretch marks, extensive stretch marks on her abdomen from just above the belly button down to the mons.
So is that unusual, that kind of a stomach? I mean, it's something I've ever seen.
I'd say at least half of the patients have that. And of course, they don't show it to anybody. In fact, they think it's disgusting.
Really?
So we have to cut that out. Certainly, fat suction has no role here. But as you said before, it's a big excision from above the belly button down to the mons.
So you're able to just get rid of that. Just cut it out.
Yes. We excised all of the tissue from the belly button down to the mons, end to end, tightened the muscle, pulled the flap down, sewed it up, and we came out with that.
It's like a brand new abdomen.
Flat and no stretch marks.
So what does a woman, she goes through the procedure, what does she say when it's all done?
First of all, she can tell the difference right away in the recovery room. And then after that, she has a few days of discomfort, but by the time she comes in to see me at a week, she already knows the difference. And in this case, we excised this tissue tightened the muscle, changed the table position, pulled the flap down, and sewed it up very low, and she has an excellent result. All the stretch marks are gone. You can't even see any left. And her clothes fit great, and she feels better, and that's a successful operation.
All right. Now, what about downtime? I mean, say they go in on a Friday, get it done. They could be back to work in a couple of weeks. I mean, if they have a sitting job.
This operation, I tell them 6 weeks to go to Hawaii. And then backing up from that, it depends. It could be 2 weeks, could be 4 weeks, and then part-time position. But they are out of bed driving their cars by 2 weeks. By 6 weeks, they can go to Hawaii. Okay. Imagine what's required for that. But by 6 months, they'll really be.
Now, do you feel like you're giving some people, their life back?
Yes, certainly. Not only do they have to buy new clothes, but they can change their sex life. It can change their behavior in public as well as private.
Very interesting topic. Final message, though. Somebody watching this, they've had their kids, not happy with their appearance, their body, their breasts, their abdomen. What do you say to them?
They should have it fixed.
Okay.
Because they're not going to get better if they do nothing. They're going to get worse and worse and worse. But one thing we haven't talked about is the anesthesia, which everyone is concerned about. Including,
they all ask about that.
Of course. But the interesting thing is that we don't use anesthesia in the usual sense. The usual sense is that you have to be intubated, which is a tube in the windpipe, and put to sleep and anesthetized with breathing through a bag, and we don't do that.
Okay,
we use IV propofol and local anesthesia. And the operations are done under local anesthesia so that when it's over, turn off the propofol and let the patient wake up. The patient has been breathing on her own throughout the entire procedure, and the only anesthesia she's had has been local anesthesia.
So you're big on safety. I mean, we haven't talked a lot about safety, but...
Yes, but the whole OR is designed for safety. The team there is experienced, they're good. We don't talk about golf or anything else. We don't even talk at all. We just do the work, and we do it well, we do it fast, we're efficient and safe.
So all of the photos that we've shown here today are on your website?
Yes, they are, plus a lot of others. We'd welcome anyone to peruse them.
Okay, good. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to watch this interview again online, visit our website at wellnesshour.com. For now, I wish you good
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.